Ebola virus disease is a rare but often deadly condition that causes fever, body aches, diarrhea, and sometimes bleeding inside and outside the body. It's caused by viruses commonly called Ebola viruses. As these viruses spread through the body, they damage the immune system and organs. Ultimately, they cause levels of blood clotting cells to drop. This can lead to severe, uncontrollable bleeding. The disease was known as Ebola hemorrhagic fever but is now referred to as Ebola disease or Ebola virus disease. While Ebola outbreaks have had death rates ranging from 25% to 90%, the average death rate is about 50%. What is Ebola virus? Ebola virus is actually a group of viruses, known as orthobola viruses. These viruses first appeared in humans during two 1976 outbreaks in Africa, but they likely have existed for a very long time. Ebola gets its name from the Ebola River, which is near one of the villages in the Democratic Republic of Congo where the disease first appeared. The viruses are found mostly in sub-Saharan Africa. They are thought to live mostly in fruit bats, which seem to live with the Ebola viruses without getting sick. But they can spread to other animals and humans, who do get sick from them. It's not clear why Ebola disease showed up in humans when it did. Types of Ebola virus. There are 4 species of orthobola viruses that cause Ebola disease in people. They are named for the places they were found. Ebola virus, which is the most common cause of outbreaks. Sudan virus, Thai forest virus, Bundibugyo virus. Scientists have found 2 other species of orthobola viruses. Reston virus, which can cause illness in non-human primates and pigs. Bombali virus, found in bats, but not known to cause illness in animals or people. How do you get Ebola? Ebola isn't as contagious as more common viruses like colds, influenza, or measles. You can't get it by breathing the air. Instead, outbreaks start when it infects people who come in contact with the blood, secretions, or organs of an infected animal, like a monkey, chimp, or fruit bat. It's possible for this to happen when someone prepares or eats an infected animal. Once inside one person, Ebola viruses can move from person to person through infected body fluids. Those who care for a sick person or bury someone who has died from the disease can get it if they come in contact with blood and other body fluids, either directly or through contaminated objects. The virus can get in through breaks in your skin or through your eyes, nose, or mouth. Ebola can spread through blood, sweat, tears, pee, poop, vomit, breast milk, amniotic fluid, semen, vaginal fluids, pregnancy fluids. People who recover from Ebola may still be able to pass on the virus, through sex and breastfeeding, for example, as long as the virus remains in their bodies. Ebola can be present in breast milk and semen, even after recovery. Other ways to get Ebola include touching contaminated needles, clothing, bedding, or medical equipment. There's no evidence that mosquitoes or other insects can spread it. Who's at risk? You're most likely to get Ebola if you come in physical contact with infected blood or body fluids of someone who has it. Generally, your risk of getting it isn't high if you're simply traveling to a country with an Ebola outbreak. But you should avoid going to the area or areas with an active outbreak unless you have a crucial healthcare or support role there. Most infections happen in communities where outbreaks are active and in healthcare facilities where people from those communities go for help. The risk is highest if you're a caregiver for a person with Ebola. Healthcare worker, like a doctor, nurse, or staff member at a hospital or clinic treating people with Ebola. Volunteer or aid worker responding to an outbreak. Lab worker who handles Ebola samples. Close family or friend of someone with Ebola. Infections are most likely when caregivers or health providers don't use strict infection control methods, like wearing gowns, gloves, eye goggles, and respirators, and using disinfectants on contaminated surfaces. Ebola symptoms. Early on, Ebola can feel like the flu or other illnesses. Symptoms show up 2 to 21 days after an infection and usually include high fever, headache, joint and muscle aches, sore throat, weakness, stomach pain, lack of appetite. As the disease gets worse, it can cause bleeding inside the body, as well as from the eyes, ears, and nose. Some people will vomit or cough up blood, have bloody diarrhea, and get a rash. How is Ebola diagnosed? Sometimes it's hard to tell if a person has Ebola from the symptoms alone. Doctors may test to rule out other diseases like cholera or malaria. Tests of blood and tissues are the best ways to diagnose Ebola. Doctors can test for the virus or antibodies to the virus. If you have Ebola, you'll be isolated from other people right away to prevent spreading the disease to others. Ebola treatment. There's no cure for Ebola, though researchers are working on it. 2 drugs are approved for treating Ebola caused by the Zaire species. Both are monoclonal antibody drugs, which work like your body's natural antibodies to target a particular infection. The drugs are Inmazeb, which is a combination of 3 monoclonal antibodies, and Ebonga, made from a single monoclonal antibody. These medicines are given through an IV line so that the drug goes directly into a vein. Ebola treatment also includes supportive measures that can relieve symptoms and improve survival. These include fluids and electrolytes, oxygen, blood pressure medication, blood transfusions, medicines to reduce vomiting and diarrhea, medicines to reduce pain and fever, treatment for other infections. These treatments may vary, depending on which symptoms and other conditions someone has. Ebola complications. Research shows that you're at risk of getting complications when you have Ebola, such as coma, multi-organ failure, septic shock, hypoxia, electrolyte imbalance, disseminated intravascular coagulation, a rare condition that causes clots in your blood vessels, hypovolemia, a condition where your body has low levels of blood or fluid, refractory shock, when your body continuously has low blood pressure, long-term effects of the Ebola virus. Research has also shown that you're at risk of having symptoms and complications after you recover from Ebola, too, including seizures, memory loss, headaches, cranial nerve problems that may include pain, vertigo, weakness, and hearing loss, tremors, meningoencephalitis, eye pain and vision problems, weight gain, belly pain, low appetite, hair loss, skin problems, trouble sleeping. Ebola virus vaccine. There are 2 types of licensed vaccines available to prevent Ebola in people at risk. Ervebo. This vaccine is approved by the US FDA and by health agencies in several other countries to prevent illness from the Zaire strain of the virus. It can be used during an outbreak to try to limit spread. The vaccine is approved for people ages 1 year and older. Ervebo isn't generally recommended for anyone pregnant or breastfeeding, but the World Health Organization says pregnant or breastfeeding people can consider whether their possible risks may be outweighed by potential benefits during an active Ebola outbreak. Zabdano and Mvabia. This vaccine is given in 2 doses. The European Medicines Agency authorized it in May 2020. People age 1 year or older can get the vaccine. You'll get Zabdano as your first vaccine dose. The second dose Mvabia is given up to 8 weeks later. But experts don't recommend this 2-dose vaccine plan during an outbreak. That's because it's not designed to give you protection right away. For high-risk people like healthcare workers or volunteers living and working in areas within Ebola outbreak, if you've completed the 2 doses, you can get a Zabdano booster shot 4 months after your second dose. How can you prevent Ebola? Keep in mind that Ebola poses little risk to most people. Caregivers and health workers responding to an outbreak are most at risk. If you are at risk, there are several ways you can protect yourself. Get vaccinated, if it's recommended for you, but don't let up on other prevention practices after vaccination. If someone has Ebola, avoid contact with their blood or other bodily fluids. Avoid contact with semen from a man who has recovered from Ebola until testing can show the infection has cleared. Avoid touching or handling things a person sick with Ebola may have come in contact with, such as bedding, clothes, needles, and medical equipment, and wash your hands frequently. Avoid going to burials during an outbreak, especially where customs may involve touching the dead person's body. If you're in an area where Ebola is present, avoid contact with bats, monkeys, chimpanzees, and gorillas, since these animals can spread Ebola to people. If you're a healthcare worker, wear masks, gloves, and goggles whenever you come into contact with people who may have Ebola, and keep up standard infection control practices even when you don't know someone's possible diagnosis. If you've traveled back from a place with an Ebola outbreak, watch out for symptoms for as long as 21 days. If you notice any, tell your doctor right away. Ebola in the United States. There's never been an Ebola disease outbreak in the United States. All the outbreaks have happened in sub-Saharan Africa. A few cases of Ebola have been reported and treated in the United States, all related to a major outbreak in Western Africa in 2014 to 2016. During that outbreak, 11 people with Ebola were treated in the United States. 9 of those people, mostly health workers, were infected in Western Africa. 2 died, including a Liberian visitor to the U.S. and a doctor who had treated Ebola patients in Sierra Leone. 2 U.S. nurses got Ebola while treating the Liberian patient, but both of them recovered. In addition, 4 people in the United States who worked with infected lab monkeys got infected with the Reston strain of Ebola in 1989. But none of those people got sick. Health experts say the risk of Ebola in the United States remains very low and that the U.S. can help keep it low by helping other countries prevent and respond to outbreaks. Takeaways. Ebola is a rare but serious disease that has caused outbreaks in Africa since it was discovered in 1976. It's never caused a disease outbreak in humans in the United States. Risks for Americans, including travelers, remain low. Some drugs and vaccines are now available to help save lives and control outbreaks. Improved infection control practices and supportive care for patients can also make a difference.